afternoon. It's great to be back in Palm Beach County here at this test center. A couple updates, and then we'll have a couple of announcements. First, today Florida reported about 361 new resident cases, but that was out of almost 20,000 test results. So the percent positive for yesterday was 1.91% statewide. So that's the lowest that we've had probably since the epidemic began, but certainly it's the lowest we've had in the last 6 or 7 weeks. Statewide, our ICU use has declined over the past couple weeks. We reported last night 497 people statewide in the ICU. We were well over 800 a few weeks ago. We also reported 269 people on ventilators. That's a significant decline from where we were 2 or 3 weeks ago. So there's a lot of good trends. The work certainly isn't done, but I think it's pretty clear in every corner of the state, flattening the curve so that the hospital system would be able to cope. That has been achieved. We have space in all the hospitals. Even as we've added elective surgeries back, you still have space to be able to cope with the coronavirus. Obviously, we hope nobody ends up in the hospital, but the healthcare system is held, and that's very, very important. Also, I'm pleased to announce, so this has been a very successful test center here. If you look, when this became online, and then we added the one near Delray Beach, we've had a lot of people come through these test centers, gotten a lot of testing done for people of Palm Beach County, which is very, very important. The diagnostic tests are important. If you have symptoms, obviously, you want to know whether you're positive, and if you are, then you isolate. Hopefully, it's not a clinically significant infection, and you don't need to go to the hospital. So you isolate. And if you're negative, you're negative. That's great. But you can be negative one day, and then a week later, you can get infected. So a negative result doesn't give you kind of a get-out-of-jail-free card forever. So it's very important to have diagnostic testing. We've actually expanded a number of sites just in the last week because we think it's very important as we're into phase 1 and beyond that we have a lot of testing in the state of Florida. So we're going to continue to do it. We've done over 500,000 tests in Florida since the epidemic began. And in most of our areas, and I think it looks like here as well, most of our drive-in sites have more capacity than the demand right now. So I would just tell people, if you haven't been tested, if you have any symptoms, please come. Your healthcare worker, first responder, come. Even if you don't have symptoms, if you think you just may have been exposed, you're welcome to come and be tested. So that's very important. But what's also important is antibody testing. So the antibody testing will determine whether you have the antibodies. In other words, these are antibodies that are created, that your body creates to fight the disease. So if you have the presence of antibodies, that means you've been infected with COVID-19. And that's very important because the antibodies, most people believe, confer immunity. At least we don't know how long, but there's some level of immunity. And then it also just will show how many people have actually had this thing throughout the state and different regions of the state. There have been seroprevalence testing that's been done in places like Santa Clara, California, LA, Miami. Dade did one with the University of Miami. And what they've tended to find is that the number of people who have the antibodies far, far exceeds the number of people who've actually tested positive. So that is important to know, and I think it's shown, and you've seen this in other controlled areas like a Navy ship, some of these prisons, where you'll have massive numbers of people test positive, but an overwhelming percentage are asymptomatic. And particularly as you talk about populations under 50 years old, most of these infections, I think most of us think, are asymptomatic. So antibody testing can be deployed in a number of ways. One is to do seroprevalence studies in different parts of the state. Miami has done one. We would like to do them in particularly our major counties to get a sense of the baseline we're operating under. But then also on an individual basis, if you're a healthcare worker, if you're a first responder, having access to antibody testing is very, very significant. We don't believe we've had a rash of healthcare workers infected in hospitals like you've seen in some other parts. I was at Tampa General the other week, and all of their infections had been healthcare workers who got it from being in other areas like New York City early on in the epidemic. but we don't know for sure. So doing antibody testing for healthcare workers is very important, and also for first responders. So today, I'm pleased to announce that starting tomorrow, right here at this test center, there will be drive-through antibody testing for first responders and for healthcare workers. So you work at a hospital, you work at a nursing home, all of that, you can come through here. We think we'll be able to do about 100 a day to start. This is a test where you actually have to draw the blood, so it takes a little bit more time than just doing a nasal swab. But when they draw the blood, they put it into the test strip, and you get a result within 15 minutes. So that's good. So the people that come through here will get same-day results, and you'll be able to determine whether you have antibodies or not. So this is one step that we're doing. We're pleased to bring that here. We've also we got the first 200,000 antibody tests delivered earlier this week, and we have put out word to all the hospitals who want some, so we've sent some to hospitals. Certainly you have a lot of hospital facilities here. I'm sure they've requested, if they have, we're going to fulfill those, but those are very, very important. These are FDA-approved tests made by Cellex. They distinguish between other coronaviruses and COVID-19, which is very, very important, and we think that the focus on the healthcare workers and first responders is the appropriate way to start. We're also introduced this at Hard Rock Stadium in Miami earlier this week. Tomorrow we're going to also be doing it at Jacksonville, at the Jacksonville Jaguar Stadium, and in Orlando at the Orange County Convention Center. And so we're starting to have a lot of antibody testing prevalent throughout the state of Florida, so we're really happy. As many of you know, on Monday we started as a state phase 1 of our Rebuilding Florida plan. It's a safe, smart, step-by-step approach informed by a lot of the leading physicians in the state, informed by a number of people, including Mayor Kerner, who served on our Reopen Florida task force. We're being deliberate, we're being methodical about this because we want to make sure we do it the right way. Now, when we did it, Florida as a state satisfied the gating requirements that the White House laid out in their document several weeks ago. We had declining indicators for ILI activity and for syndromatic indicators associated with COVID-19. We also had declining cases, but more importantly, because we've expanded testing, really great decline in the rate of positivity. And actually, Palm Beach now, they were at 18% a couple weeks ago. Now they're under 10% for all the positivity, which is a good trend. So we had that, and then clearly we had enough hospital space statewide to be able to handle any type of uptick. So we qualified as a state, but we also looked at it and said the epidemic was different in different parts of the state. Certainly Southeast Florida, the 3 counties, Broward, Palm Beach, and Miami-Dade, had more seeding. I think it's pretty clear, probably from the Northeast and New York City. And so they've had to deal with a different epidemic. And so we wanted to make sure that they were able to proceed in ways that their community supported and that made the most sense. So when we did phase 1, we did the 64 other Florida counties, but we knew that the trends in these 3 counties, the epidemic was more difficult, but the trends were still positive. And so I've been working, and we've worked together with the counties from the beginning. It's a bottom-up process. You got to do it that way, collaborating so that we can move forward together. I received the letter yesterday from Mayor Kerner, and I know the commission in Palm Beach County is interested in moving to phase 1. So that's something that we considered very significantly, and we believe that getting as many counties into phase 1 is something that we would want to do, but we want to do it safely, smartly, and it's going to be step by step. Our overarching strategy does not change with respect to COVID. The form it takes may change, but the key points are going to remain the same. Just because you go to phase 1, that does not mean the disease is going away. It's not going to just go away magically. The shape of it may be different. We seem to be on a decline in many parts of the country, but nobody really knows exactly how this thing's going to bounce. So we're always going to stick to the plan of protecting the vulnerable populations, particularly our elderly, continuing to increase not just diagnostic testing, but serological testing, promoting social distancing, which is very, very important. And that doesn't mean you got to be locked in your house to social distance. There's other parts of that. In fact, most social distancing doesn't really even have anything to do with sheltering in place. We're going to continue to support hospitals and our healthcare workers, and we're going to continue to work on preventing the introduction of the virus from out of state. I'm working on a plan to submit to the president for international flights coming into places, particularly South Florida. You look at Brazil or some of these places in South America, if they have the epidemic on the upswing there and people are coming into Florida, they could be introducing that. That should not be a risk that is placed on Floridians. That's something that the airlines need to work out on the front end. So we're working on how that would make sense. And then, of course, we have screened between 40 and 50,000 people coming from hotspots like New York City into the state of Florida. And I did do a quarantine order very early on. I think that's been very, very effective at both a deterrent message saying don't come if you're in one of these hot spots, but then also having people actually self-isolate and reducing the spread of what we would otherwise see. So we're going to continue to do that. Phase one, the White House put out some guidelines for phase one. My task force put out some recommendations. The phase one that we launched in Florida was an important step, but admittedly it was a small step. It wasn't a huge difference from what we've been doing. There were things that the White House said would be okay to do, like movie theaters. There were things that my task force recommended we do that I decided not to do in phase one because we want to be very measured about it. We want to be safe and we want to be smart. So what we did do in phase one was obviously continue the kids on distance learning for K through 12. We've continued having the prohibitions on entering senior living facilities. We allowed elective surgeries to proceed, which was banned per CDC's guidance to conserve hospital space, but really to conserve PPE. We're now at a point where we're able to turn that on, and the hospitals who do it are effectively having to certify that they have enough PPE, they have enough surge hospital capacity in the case of an uptick with COVID, and that they're willing to help with the assisted living and long-term care facilities in their area, because I think we all recognize that is the most significant area that would be susceptible to a major outbreak that would have major clinical consequences. So that's kind of how they've done, but they've been able to put some of these back on the calendar. And just because something's elective doesn't mean it's not important, and it doesn't mean it's not necessary for people's health. So we felt we really needed to do that, which is very important. We've also expanded the ability of restaurants to serve their customers. They've been able to do carry out and take out this whole time. We've allowed to do outdoor seating with the appropriate social distancing, and then 25% of the indoor capacity, of course, appropriate social distancing there. Now, restaurants who were totally closed may not open at 25%. They may wait until we get to future phases. But I think for most restaurants who have been open, being able to have some limited indoor seating as well as outdoor seating, I think that that's a step in the right direction. And then we also allowed the remaining retail who had not been operating with indoor capacity to do that at limited capacity. A lot of retail was going on during this time. Home Depot, some of these places, Target, Walmart, all those things remained open. And so these are small steps, but they're not radical changes for what we've been doing. But I think it's smart to proceed methodically. And so I've looked at Palm Beach's request. I am going to authorize, starting Monday, Palm Beach County to move into phase one, consistent with what we've done. And we think that they're ready for it. I think the people here are very smart. We understand the responsibility that we all have to protect the vulnerable populations here. I have Mary Mayhew, who's going to say a few words, our Secretary of ACA. She's worked from the very beginning with the hospitals, with the long-term care facilities, to develop solutions to protect our most vulnerable residents. If you look, some other states actually had policies that would require sick COVID patients to go back into a nursing home that wasn't equipped to handle it. That obviously led to outbreaks and disastrous results. Mary, from the very beginning, has understood the risks associated with doing that, work with the hospitals to prevent that. And we've had a lot of hospitals in Florida that have really been proactive. If there's signs of an outbreak, they've sent people. There's been testing. I have the National Guard going to nursing homes. We've got 50 teams going out and testing. This I'll say a little bit more about, but this is one of the first, we think it's the first rapid test mobile lab than anyone's done in the country, and that is serving our nursing homes. So we have to do that going forward. Palm Beach, the hospital's here. Mary will talk about, she's worked with them. It's very rare to get all these different healthcare providers on board, but I think we all recognize that this is a disease that does not affect everyone equally. In Florida, I think we're now at about 83–84% of fatalities are 65 and up, and 61% are 75 and up. So the vulnerabilities are clear in terms of where that lies. So working collaboratively with the local government, with the hospitals, with ACA, Department of Health, National Guard, to be able to protect these vulnerable residents is really, really important. We were just in Jacksonville, and Mary, Secretary Mayhew, developed a relationship with a long-term care facility that is capable of isolation, negative pressure, and having COVID patients without it obviously spreading. It follows CDC guidelines. So what that is now doing is they partnered with the state. If you have an outbreak at a nursing home and you have a patient who doesn't require hospitalization, but it wouldn't be safe to send them back to their nursing home, they can go to this facility where it's safe. Or if you have somebody who's hospitalized, but then they're ready to be discharged, but they're positive, you can send them to this facility. So that whole region is now using that approach. And those are the type of creative solutions we need to do. So that's going to be very important that what's being done in Palm Beach continues because we have to protect the vulnerable as we move forward. I think Palm Beach, if you look at what they've been able to do, they've had a lot of challenges because you've had a lot of traffic, this whole year, January, February, early March, back and forth. Even New York, once they did the shelter in place, you had people flee down here. And although we did the quarantine, it's just a tough thing. You had people getting on flights who were COVID positive landing at Palm Beach International. So they've had to deal with a lot, and I think the local government here has worked really, really hard throughout this, and we've enjoyed the partnership. But if you look, Palm Beach has certainly seen a decline in the number of tests that come back positive. They were 18% a couple weeks ago. They're now 9%. Most recently, they've been between 3 and it looks like 7.5% over the past week or so. That's a good trend. The one day, May 3rd, where we saw more cases reported that had been different from the trend we had seen was a function of us setting up the walk-up sites in some of the underserved communities. That's not a bad sign if you're going into places and expanding testing to communities who probably wouldn't be getting tested. So being able to do that, I think, is very important. And we're going to continue keeping the walk-up test sites because I think that's been a boon to some of the communities here. But Palm Beach's indicators for ILI and COVID have gone down. Certainly, if you look where they were at the end of March till now, and then you look at the hospital admissions, I think the hospitalizations have basically been flat now for a couple weeks. There's clearly capacity here in the hospitals if you were to see an uptick. I'm hoping not, because I think that they're doing a lot of great social distancing, and I know some of these businesses are very intent on doing that. But that's just the reality. You have significant space in the hospitals as we go forward. So I think Palm Beach is incredibly important for our state. This is not like flipping a switch. It's not just going to go back overnight. But I think if we take, nice, strong, methodical, safe steps forward, we're going to be able to get people back to work. And you can put people back to work and still support our seniors. You can put people back to work and still send PPE to long-term care facilities. You can put people back to work and still have procedures in place so that these residents are cared for appropriately. Florida has now sent 10 million masks just to long-term care facilities since the epidemic started.